day, we have a responsibility to those who are not in a position to make informed choices or decide for themselves as to what is in their best interest. Children have a say, but we as adults need not reinvent the wheel. We've all passed through the stage of primary school. We know the challenges faced by children who are trying to come into themselves, who are getting to know themselves, who are about to transition into a different environment and step up to a secondary or high school level. We know the pressures that they're going to face as children. We know the dangers of peer pressure. We also know, because of our association with this council or similar organizations, the dangers of illegal or harmful substances on their young brains. Children are naturally curious. That is the nature of being a child. Children want to investigate what they don't know. Children want to be cool. We have a duty. It is incumbent upon us to share with them the dangers that we know and to explore the dangers that we don't fully appreciate so that we can guide them when the information becomes known. Scientific and empirical studies such as the one about to be presented today form the baseline. They inform us so that we as governments, or we as NGOs, or we as institutions can formulate the correct policies and target our resources in a meaningful way based on information and not anecdotal evidence. I am very proud, having read the survey, to be associated with this survey. This is pioneering work. Years ago, we might have to focus on children when they hit puberty or adolescence, but children are maturing faster. I am pleased to address you this evening at the meeting convened to highlight the much-awaited key findings of the National Primary School Survey 2020. The national response to the local drug problem requires reliable and up-to-date information. Therefore, surveys such as the one you're about to hear are important tools for policy making and programming, as they provide an understanding of the drug situation, thereby enabling us to craft the most appropriate responses for specific populations. Ensuring the appropriateness of our responses is especially important for the youth, as research has shown that drug use during adolescence is associated with a number of negative outcomes, including low educational attainment, involvement in crime and substance abuse disorders, and these carry on into adulthood. In fact, the Centers for Disease Control have stated that the majority of adults meeting the criteria for substance abuse disorder began using substances during their teen and early adult years. Adolescent substance abuse is also associated with risky sexual behaviors, including early sexual initiation, having multiple partners, and not using condoms, all of which put our youth at risk for HIV, sexually transmitted diseases, and early pregnancies. Such negative outcomes can have a lifelong impact. It is therefore incumbent upon us to take every step to prevent the early onset of drug use. And findings such as those about to be presented today can inform an evidence-based approach, which of course is the gold standard. I understand that this National Primary School Survey is a third of its kind to be conducted in Barbados, and was informed that the NCSA has adapted and modified its data collection instruments for each of the survey rounds so far. This approach ensures the relevance of the surveys and has enabled the Council to address critical issues at each point in time.